Um, okay, well, welcome. Good evening, everyone. I want to welcome you to our fourth and final EPIC training event of the academic year. I'm Allison Updike-Neff. I'm Associate Professor in the Graduate Social Work Department here at Westchester. I just first want to say a quick thank you to our two Wendy's, Wendy Meyer, our EPIC Program Coordinator, and Wendy Lee, our Graduate Assistant, just for all of their work in organizing these events. So we're very excited about tonight's presentation. Both Erica Smith and Nhakia Outland will be presenting on integrated approaches to sexual health education. In the first session, Healthy Sexuality in America with Erica Smith, we'll discuss the importance of comprehensive sex education for people of every age, from children to adults, the topics that should be covered for the promotion of ideal sexual health, best practices for providing sexuality education, and how purity culture plays a role in America's experience of sexual health. The second session, Integrating Sex Education and Social Work with Black Girls with Nhakia Outland, will focus on using an integrated care model to address the gaps in sex education for Black girls, emphasizing the crucial role social workers play in providing effective and culturally relevant sexual health education. You can click the link in the poster for the event to read the bios and just learn more about these two amazing people. Just a couple technical notes about tonight. The session's being recorded, so you probably saw that. We'll ask that folks remain muted throughout the training, so we'll have time for a brief Q&A following both presentations. So we'll do both presentations back to back, and then we'll have time for a Q&A afterwards. And so the chat is disabled right now, but it'll be enabled for the Q&A, and so you'll be able to write your questions in the chat after the presentations have ended. Secondly, if you haven't already, just log in with your full name to make sure that you get attendance credit for tonight. If you need to change your name, there's 3 little dots in the upper right-hand corner of your window. You can click on those dots and you should see something that says rename, and you can rename yourself there. And finally, those ever important CEUs, if you would like a CEU certificate, just make sure that you're here. You got to be here for the whole training, complete the post-test survey, and then at the end of the post-test survey, there is a CEU certificate request form that you can do while the event is still live. So your future self will thank you for starting to bank those CEUs early. And so again, that link is available at the end of the post-test. If you haven't already, just want to ask that you complete the pre-test, and so that you can look in the chat for that. There's a link. And just make sure that you don't need to complete that more than once. Just once is great. With that said, I think at this time, I'm going to go ahead and turn things over to our first presenter, Erica Smith.
All right. Good evening, everyone. Thank you for being here tonight. I am going to share my screen and get the slides going for my presentation. Okay. It seems the title I gave my slides is slightly different than the title I gave Allison, but I think that's fine. Hopefully that's fine. Okay. So today I am going to talk to you about supporting the optimal sexual health of young people. And as Allison said, we're going to talk about some of the trends that are happening with young people in sexual health and talk about how to best support them. So you may have read my bio, but I just want to introduce myself and talk about how I have been doing this work. So for quite a long time, I worked for CHOP, and I did a program that had us going into the juvenile justice center in the city and finding the young people that were highest risk for unwanted sexual health outcomes. And our program would provide them with supportive services, social work, case management, and comprehensive sex education. I no longer specifically do that work, but I currently have a program that helps people who were raised in very high control religions learn the comprehensive sex education that they missed growing up in that particular religion. So, what I mean by that, the term purity culture may or may not mean something to you. I'm guessing some of you here are like, I totally know that. Maybe it's your experience. But purity culture refers to a strict set of rules around gender and sexuality that is found in pretty much every fundamentalist version of major world religions. What I tend to encounter most are people that were raised in very strict fundamentalist Christianity and who were raised with the idea that all sex outside of marriage is bad, that sex is never for a woman's pleasure, that the virginity is the highest worth a person can have, especially women. And a lot of information about sex and sexuality that's healthy is intentionally kept from people. And when people have no access to good sex ed and they're raised to deeply fear sex and fear their bodies, that sets them up for a lot of problems when it comes to having sexual relationships and even a relationship to their own bodies in the future. So it's a big topic because while you may have grown up in an environment like that, even if you didn't, that sort of rhetoric sort of undergirds the American culture. We are a puritanical nation, and this is a country that even if you don't grow up in a religious environment, those values seep into secular culture. And an example of that would be the way that abstinence-only education is given funding and pushed in public high schools. And it's been that way since the 90s. Another example is a lot of the legislation that's currently being presented and attempted to pass by our governments, federal and state level, that restrict sexual expression, that restrict LGBTQ identities and lives, and that restrict sex education and reproductive rights access. So that is kind of just the Cliff's Notes on what purity culture is. And a lot of my work is informed by the idea that we deserve better. We deserve full access to information about our bodies, and that it is not harmful to understand sexuality as a healthy part of life. So, because we're talking about teens, I just want to like put it out there that I know the phrase, even just the phrase teen sexuality can elicit some strong feelings. And I understand that fully. I do want to just say that we are all coming from different values. We come with different attitudes, different religious backgrounds, and different experiences with our own sexuality. And the thought of young people being sexually active may be uncomfortable for you. So it is okay if the subject matter is uncomfortable or awkward. I'm sure that Nhakia would co-sign that even if we are uncomfortable with the idea of teens being sexually active, it's still happening. So it's something that we really should be facing head on. Okay, skip that slide. I'm going to skip that slide too. So here's the thing. Sexuality isn't something that just happens to us when we reach adolescence or when we turn 18 years of old. We are sexual beings from the time we are small children. And what I mean by that is not that we are interested in sex in the way that adults are interested in sex, but I mean that young children are curious. I say we because we were children once. We are curious about our bodies. We learn that body parts have names, and depending on our family, we might learn that those are bad words that we don't say, or that we use silly words in place of actual anatomical words. Children do discover that their bodies can be sources of pleasure, and this is different than an adult having an adult experience of their sexuality. It is very common for a child to touch their bodies, including their genitals, and understand that that feels good or comforting to them. As children, we also are observing the world around us. We see that people touch and kiss to express affection. We see that there are different kinds of family and relationship structures. We also start to really see that there are different social expectations for girls and boys. So we are learning the gender roles that society has created for us. And we also, especially if we have siblings or if our families are comfortable with nudity, we learn that body parts look different, that some people have different genitals. And we also ideally learn that some parts of our body are considered private. So these are some of the ways that children experience their sexuality. That's early to middle childhood. Now, during adolescence, this is when our hormones are starting to amp up. We're going through puberty, and lots of changes are happening for us at this time. Probably none of us like to think back on this time because it's rough, right? Going through puberty is not a fun experience. So during adolescence, we have puberty happening. We are learning more about gender and social roles. We are also learning sexual scripts. And what I mean by that is, do you ask someone out? Do they ask me out? Is it okay to kiss this person? How do boys and girls interact with each other? We also begin to develop, depending on our environment, a clearer sense of our sexual orientation or gender identity. So we do not assume that all young people are going to be straight or that all young people are going to identify with the gender, with the sex they were assigned at birth. And adolescence is really a time for a lot of people where they start asking these questions and having these realizations. We also experiment with our body. So for many young people, that does mean masturbation. And many young people do start experiencing powerful attraction and erotic feelings. Young people who identify as asexual may not fall into that, may not have that particular experience, but the majority of young people will. Another thing, and I can tell you this from working with teens for a long, long time, we all worry about whether what's happening to us is normal. Is my body normal? Are my genitals normal? Is this thought I have normal? Is the fact that I want to kiss this person normal? Is the way I touch myself normal? Like, we all have those worries when we also are adults, but especially in young people. The number one question I get from teenagers is XYZ experience normal? And 99.9% of the time, it falls within total normal ranges. It's like not an unusual experience. Young people also begin to be concerned about their sexual attractiveness to potential mates. They might start to date and frequently, have crushes, fall in and out of crushes and relationships. They're starting to understand their capacity for love and love in an intimate, romantic way. And many young people will have their first sexual experience, which I refer to here as sexual debut. And the reason I use that word is because I don't think virginity is a useful word. Virginity is the word. It's very common, but it doesn't really mean anything. If you say, I'm still a virgin, there are people that will say that who also may have had types of sex other than penis and vagina. So I know of some people that consider themselves virgins when they had been having oral sex, or some people that consider themselves virgins even when they'd been having anal sex. I prefer the term sexual debut, meaning the first time you have a consensual sexual experience with another person, however you define a sexual experience. And ideally, young people are also getting information about sex that's accurate and learning how to care for our sexual health, which is where we come in. Sex is Dating is important at this time period for a lot of young people. The new social meaning given to sex and dating behavior in our teens makes it a big psychosocial concern. And here's something that is so interesting. And I know depending on your generation, you're going to be like, whoa, because I am like, whoa about this. But teens are having way less sex than they were having decades ago. The percentage of US high school students who ever reported having sexual intercourse, which intercourse, I believe this is the Youth Risk Behavior Survey. So I believe that sex is defined as intercourse meaning penis and vagina. So in 1991, over half of teens reported having sex. It dropped in 2007 It dropped in 2019, and the most recent data we have from the Youth Risk Behavior Survey is that only 30% of US high school students have reported experiencing sexual intercourse. Many people want to know why. There are lots of theories about this, lots of writing about this, and one big factor is definitely the way that we use social media and the internet. So I'm like, if you want to go down that rabbit hole, I encourage you to. There's really not time to talk about all the whys, but teens are having less sex now in general. However, sexual activity still continues to be a normal part of adolescent development. The majority of high school students do become sexually active by the time they graduate from high school. So it tends to be, if you would take a survey of like ninth graders, the chances that they've had sex is way lower than the chance that a senior in high school has had sex. And that data point has remained true for decades now. Another thing that's interesting is that teen pregnancy rates are dropping, and they have dropped significantly since the 1990s. And the main reason for that is the availability of long-acting contraception methods. So we no longer have to worry about taking a pill every day if we can get an IUD, if we can get the depot shot, if we can get the birth control implant. Using these methods that don't require very much thinking on our part has really been a good thing for the teen pregnancy rates. Now, you might be wondering, why do teens have sex? And the truth is, for all the same reasons that adults have sex. They have sex for intimacy, for pleasure, for love. Sometimes they have sex because it's expected of them, for their social status, for their peer pressure. That's what's going on in their friend group. There are also teens that engage in sexual activity as a means of survival. So survival needs and sex work. And sometimes teens have sex intentionally to get pregnant. This happened for many of the young women that I used to work with in the Juvenile Justice Center. So sexual behaviors do differ by race and ethnicity, gender and partner preference, and whether kids live in urban or rural areas. So there are many factors that influence whether or not a young person may be having sex. So some of those things also are socioeconomic status, ethnicity, family structure, what they see themselves doing as adults, if they are able to even conceptualize a future in that way, how old they are. And again, younger teens have less sex than older teens or are less likely to have had sex. Other things like life experiences, trauma, relationship experiences, whether they're actually dating or not, and their religious upbringing. These all can influence whether or not young people are sexually active. So in the Youth Risk Behavior Survey data that we have most recently, like I said before, older teens are more likely to have had sex than younger teens. Only 3.2% of students reported a sexual experience before 13. Males were significantly more likely than females to initiate a sexual experience before 13. And I think I think we all know here that if you are under 13, you are under the age of consent. There are a lot of things to be concerned about in this situation. And I'm sure Nhakia has as well, have worked with and encountered many, many, many young people who had a sexual debut before age 13. And these tend to be young people that are marginalized in other ways and are a lot of times dealing with childhood trauma in their lives. So the Youth Risk Behavior Survey, it studies things like, are we using condoms? Are we using birth control? Are we having sex? Are we drinking? Are we doing drugs? But it's also missing some really important things that have to do with sexuality. We don't know these other things. So the YRBS frames adolescent sexuality purely as a risk behavior. But whether adolescent sexual experiences are healthy or not, that's not taken into consideration in that data. So there are other questions that I really think are important, such as, are the young people who report sex, are they consenting? Are they happy with the fact that they're having sex? Do they feel safe? Are they actually desiring the sex they're having and experiencing pleasure? Is it good for them? Do they feel affirmed with regards to their sexual orientation and gender? And are they in positive relationships in which there is trust, communication, and respect? These are the things that that survey doesn't quite measure, but that are incredibly important. So, definition of sexual health from the World Association for Sexual Health is sexual health is not just whether or not somebody has an STI. It is a state of physical, emotional, mental, and social well-being in relation to sexuality. It is not merely the absence of disease, dysfunction, or infirmity. Sexual health requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences free of coercion, discrimination, and violence. So that really says a lot right here. Sex education in America tends to focus on the absence of disease part. We tend to just talk about condoms, show some scary pictures of STIs that are like really not typical. They're bad enough to end up in a medical textbook. And we talk a lot about pregnancy prevention. But if sexual health requires a positive and respectful approach to sexuality and relationships and talks about pleasure and coercion, we're not getting that in a traditional sex ed classroom. Um, it is not at all a secret that abstinence-only education is ineffective. And when I say it's not a secret, it's been studied. There have been longitudinal studies over the years from the time that abstinence-only education really started to take root, which was partially because of the rise of the AIDS epidemic and also because of the rise of religious influence in American politics, which really started in like the late 1970s and early 80s. So the theory behind abstinence only education is that we just got to tell young people not to do it. And if they don't do it, then they won't have these problems of sexually transmitted infections, they won't get pregnant, and they won't, get their hearts broken and have to deal with all of these things. But just telling young people to not do it is not effective. You can look up the studies, they are there. What tends to be effective and what has been shown to be effective is more comprehensive sex education that provides information that covers the whole range of topics, not just the ones that have to do with bodies and using condoms and birth control. I'm going to share a quote from a sex therapist that I really, really appreciate. The quote is, "Sex education that only focuses on STIs is like a culinary school that only focuses on food poisoning." That would be ridiculous, right? You want to go to culinary school to learn how to create wonderful, delicious food. You want to know what ingredients make a meal good. You want to know what techniques to use to create the outcome that you want to have. And if we're thinking of sex education in that way, there's a lot more to teach people than here are the bad things. So we have some not great news about the United States. Despite our lower rates of adolescent pregnancy, despite the fact that it's been falling for decades now, the US pregnancy rate among 12 to 19-year-olds is still one of the highest in the developed world. And STIs among 15 to 20-year-olds account for nearly half of all STIs reported in the United States. We know exactly the ways that we would reduce these rates because countries like the Netherlands, France, and Germany have a similar population of teens. They're similarly like a westernized country, and their young people have very, very low rates of STIs in pregnancy. And that is because the families talk to them frankly about sex. They have access to great health care. There's a lot of health promotion in their country around sexual health. And the topic is just not as stigmatized as it is in America. So we see we know that this is how you would lower these rates, but it is very hard to do in a country that is very steeped in the idea of purity culture and that talking about sex is bad. And when there is so much influence in government policy that treats sexuality like it's this terrible, dirty thing. So the state of sex ed in America is pretty grim, and I did make this slide prior to the 2024 election. So if things have gotten even worse, I am not caught up because who can even catch up? There's a lot going on. But as of last year, 29 states in the District of Columbia do mandate sex ed, but that doesn't mean that all young people are getting really good sex education because 35 states require schools to stress abstinence only. So you could have a sex ed mandate that also requires you to stress abstinence. Only 16 states require teachers to talk about condoms or contraception. 15 states do not require sex ed or HIV instruction to be age appropriate, medically accurate. Hear that. They don't require sex education or HIV education to be medically accurate or culturally responsive or evidence based. Only 9 states require sex ed to include information on consent. 7 states have policies that include affirming sexual orientation instruction on queer identities, but 9 states explicitly require instruction that is negative towards LGBTQ people. So think about how the average young person who might be a straight cisgender young person is being left behind with this sex education. Now imagine that you are a queer or trans youth and they're not even talking about you as if you exist. So how are you going to understand or get quality sex education that's actually going to be relevant to you or protect you? After working with teens for over 20 years now, and having been a teen myself, here are the things that teens want to know about. They want to know about what makes a relationship healthy. They want to know about pleasure, like sex should feel good for people. They want to talk about intimacy, how you build it, how you build trust with people. They want to learn how to communicate and set boundaries, meaning how do you say no? How do you say yes? How do you say, I'm willing to do this activity, but I don't want to do this activity? That can be really, really difficult for young people and adults. They also want to know about LGBTQ identities. Not all young people are straight, not all young people are cisgender. They want, again, the conversation about consent. How do I tell someone no? We also really should talk about how to gracefully accept a no, um, which can be really difficult. Last night, I was actually speaking at a university, and the college seniors were sharing that it is really difficult sometimes for people to say no and to accept a no. So they also want us to talk to them about sort of building the confidence to navigate sexuality and how to deal with new situations. Like if they're meeting a new person or kissing someone and, something happens or a question is asked, they want to know how to respond to stuff. So merely saying, here's how to use a condom, don't get pregnant, you shouldn't have a lot of sex, that does nothing. That is like just the teeny little tip of the iceberg when it comes to what young people should actually know. So because I worked in the Philadelphia juvenile justice system for so long, a lot of the young people I worked with were not just justice system involved, but dependency system involved. So a lot of kids had cases open in the child welfare system, dependency and delinquency, crossover court, as it called. So a lot of the young people, as I'm sure you all probably know, the kids who come in and out of juvenile detention are the same kids that go in and out of foster care and in and out of the child welfare system. And they are at higher risk almost for all unwanted sexual outcomes across the board. And what I mean by that is for sexual violence, experiencing sexual violence, for acquiring an STI or HIV, and for experiencing an unintended pregnancy. Youth living in poverty may not perceive the risk of STIs, or they may not practice preventative behaviors if other things are going on that are way more imminent and threatening to them. So, for example, if you are a young person that has been kicked out of your house or your parents are in jail and you don't have a place to stay, you could be couch surfing, living in shelters or with friends, and many, many of them, including LGBTQ youth, will be engaging in sexual behaviors in exchange for the things that they deeply, deeply need. So we call this survival sex. They may be trading sexual experiences for food, for shelter, for money. The amount of young women that I know that have been like, I needed diapers, I needed formula, I needed a place for me and my baby to stay, so I went home with this guy. That is survival. And that also means that you have less agency to maybe speak up and say, hey, I want to use a condom with you. Or, hey, I don't want to do this unless you've been tested. That is not like, that is really not something that a lot of these young people are able to say. And it might be a secondary concern. If they're like, look, I really just want to get out of this winter. I kind of don't care if he uses a condom because I need a bed to sleep in. And that's something that happens all of the time. Interesting thing that I think may be something to just really, really take note of is that young people that have experienced trauma have more difficulty with sexual decision making. And here's a wonderful quote. Sex education doesn't ensure abstinence, pregnancy prevention, or protection from infection, disease, and harm. Many young people who have received accurate sex ed continue to place themselves at risk of harm. Life experiences greatly influence choices about sexual health and well-being. Trauma greatly impacts decisions young people make about sexual expression. So imagine if you have a young person who is street involved, who does move in and out of the juvenile justice system, who does not have stable housing, that young person could learn all the sex ed that I have to offer. I could teach them about every single topic, but that doesn't change their situation. And it doesn't change the experience of living with trauma and making decisions from that place. And that's something that I really want people to remember when working with young people, because I have seen adults in positions of social worker or teacher or child advocate or doctor or nurse who get frustrated and they're like, why does she keep coming back with STIs? Why does this kid keep coming back and they're not using condoms? And it's like, because it's not that easy for them. And if we push our own, like they should be doing this as I think they should be doing, if we push that on them, we're going to push them away and alienate them from us as providers or educators. Um, Research has shown that justice involved youth, and again, justice involved youth and kids that are involved in the child welfare system, lots of crossover here. They are more likely to have sex earlier than their peers. They're more likely to engage with a higher number of sexual partners. They contract STIs at a higher rate. They experience much more sexual trauma. They also are likely to engage in transactional sex and they use condoms less reliably and consistently. So if you are working with young people that you would say fall into this category, that is something to be aware of. Also, there is a alarmingly high rate of sexual violence and abuse among this young population, especially justice-involved girls. The rates are highest among young women of color, LGBTQ youth, and disabled youth. And very often, girls who are arrested and charged for common offenses like running away, drugs, truancy, so many of them may be coping with or escaping abuse. And I can think of specific young women off the top of my head right now that I have worked with who had this situation. They were being abused at home. Maybe they told mom, "Hey, your boyfriend or your husband is abusing me, is sexually violating me." The young person is the one that gets kicked out of the home. So a lot of times we see girls and LGBTQ youth getting caught up in the system for this specific reason. Um, Okay, let me go back before I say that slide. I feel like my transition there wasn't good. So in general, I've just shared that teens American high school teens are having less sex than American high school teens were in the 90s. But the Youth Risk Behavior Survey specifically looks at young people who are in high school. And there are plenty of young people in this country who are not whose behavior isn't being captured by the YRBS. And so those are the young people that I know I worked with specifically. But I just want to switch gears for a second and talk about the way that adults often perceive the sexual behavior of young people as if it is so much worse than it was when we were kids. And, I've heard people say these things, and I've even had these thoughts myself, which is like, oh my gosh, kids these days are doing XYZ. I can't believe that. We didn't have that. We didn't do that. And for many things that there are some truths to that, such as the impact of social media, the impact of smartphones, and the way that really impacts youth sexual behavior. Um, I feel grateful all the time that I was in high school before social media, and many of you who were, maybe you feel that way too. So I didn't have to contend with the thought of like people posting photos, or young people now have the ability to create their own sexualized content. It's like instead of just finding a dirty magazine in the woods, people take their own photos. So it's like you become the creator of sexualized content. That is really a different thing for this generation, and not something that previous generations had to contend with. So there are some things that are different to know about, but in general, the moral panics that adults tend to have about young people are pretty unwarranted. So this slide, there was a wonderful book called Kids Gone Wild, where a researcher sort of disproved that young people were having all kinds of debaucherous sex compared to their peers. And she focused on what we call moral panics, like people starting urban legends about teens are doing this, teens are doing that. And so, a quote from that book that I think is important is the belief that society is on a nonstop descent into sexual debauchery can persist, even as modern teenagers actually trend in the opposite direction. We tend to see a lot of talk about how the behavior of youth is getting worse over time, and commentators talk about that in graphic detail. In fact, several indicators suggest that the sexual behavior of youth has actually moved in a more conservative direction than their parents' generation. So, yeah, kids in the 90s were having a lot more sex than kids in the 2020s. So, if you work with young people and you have the opportunity to be involved at all in conversations about sexual health, one of the most important things we can do is check our own values and assumptions. And that requires some pretty serious inner work, like asking yourself, what did I learn about sexuality? What do I believe about sexuality? What are some of the biases I might have about young people and their sexual decision making? And I want you to know that it's okay to have any values that you have for yourself and for the people in your life. But if you are providing services to a young people, what we owe them is understanding and not shaming. And I have seen so many adult care providers who, in many cases, are well intended, but end up heaping shame on young people for having STIs, for having sex, for switching boyfriends and girlfriends and partners, for, forgetting to use condoms, for being teens. And that doesn't help at all. In fact, that is something that could push young people away from us. I think it's important to remember that young people's sexual decision making and risk behavior, if you're seeing a lot of that, is often driven by trauma responses and outside influences. It's not because the kid is like, I'm going to be a bad kid and I'm going to go out there and do something that people consider sexually immoral. Like, that isn't what's happening. The other things that do not help young people are when we only focus on the negative outcomes, when we're only like don't get pregnant, don't get an STI. I think it can be really helpful to be curious about what teens are doing and to ask them questions like, why are why do you like this person that you're dating? What are the two of you, what do you have in common? And do you feel safe with them? And what makes you feel safe with a partner? These are the questions that I used to love to sit, these are the conversations that I used to love to sit and have with the young people in the detention center. It was like, no, not many adults had ever asked them to solicited their own feelings and feedback about their experiences of dating and sex. It also doesn't help when we pretend that we did everything perfectly as teens, because, most of us didn't. So don't act like it is, so easy to just stay on the straight and narrow and that they're doing something real crazy and that, we wouldn't have done that as a young person. It does not help young people when our disapproval of their behavior is obvious. And when we stigmatize and devalue their sexual experiences, including romantic relationships. Like, nothing pisses off a young person more than if you like poo-poo their relationship. Like, oh, he's just some dumb little boy, or you don't know what love is. This is just puppy love. You don't understand yet. I mean, because to young people, this is so serious and real. And I'm sure that if you put yourself back in that experience when you were a young person or when you were a teenager, you can remember how big and real things felt to you. So being an adult, does not give us an excuse to devalue their relationship experiences. And you might think that stuff in your head, but it's really good to get good at leaving it there. Because I'm not going to lie, I definitely have snap judgments, but what I try really hard to do is to never convey those snap judgments to the young people that I'm talking to. And another thing that does not help teens is when we withhold information for their own good. So if a kid would say, "Hey, I want to talk to you about how to have safer anal sex," maybe your brain goes, "Oh my gosh, young people shouldn't be doing that." That's fair. Your brain can say whatever it wants to itself. But saying, "Well, I'm not going to tell you that because it's for your own good," withholding information is not helpful. They're going to go find it some other way. They're going to find it on TikTok. They're going to ask their friend. They're going to ask, their cousin or something. And the amount of sexual misinformation that gets passed down from, peers, older generations to younger generations is really astronomical. I swear half the time when I was in the detention center, I was correcting misinformation that they had heard. Like, so is it true that, a girl can have so much sex that her vagina just gets loose and stretches out forever? No, that's not true. There are a lot of things that they hear that why wouldn't they believe them? Because, this adult they trust or their brother or their cousin or their friend or their aunt, tells them stuff. So it's important to provide accurate information when we can and realize that withholding it, if we withhold quality sex ed information, they're going to find information somewhere else. Teens need us too. Provide sex ed that is evidence-based, trauma-informed, and culturally sensitive. There are some wonderful sex ed resources that I'm going to share with you if you need that kind of information to provide the young people that you might work with. They need real-life practical info about sex and relationships that does not just focus on STIs and unintended pregnancy, but also includes information and conversations about attitudes, values, relationships, consent, communication, gender, and sexual identity. They also love when we talk to them matter of factly. Like, talk to them like I talk to teenagers like I'm talking to all of you right now. I have one mode. This is how I talk to everybody. And I think that they really appreciate when you talk to them like they're young adults who have agency that deserve to have a respectful and serious conversation. Um, Also, actually listen to them and ask for their input. Again, this is where like being curious about what they're doing is really important. Like, hey, why do you think, your friends are doing that? Why do you think all your friends are having sex? Or what do you think about the fact that, so and so is having a baby. What do you think about the fact that, your friend might need an abortion? Like things that talking to them about their feelings and what information they have can be a wonderful, wonderful way to just get into a good conversation about this stuff. It's also really important to keep a good poker face. And I'm sure that any of you, if you have a role where you work directly with other humans, whether they're teens or adults, you probably have a good poker face. Clients are going to say things to you that might make your brain go, oh, wow. But you got to keep your face like, mm-hmm. And that's really useful with young people. And I think it's also important to remain in touch with how hard it is to be a teenager. It is really hard to be a teenager. I can't imagine what it's like to be a teenager in 2025 with all of the technology that they have, with all of the worries about the world that they're dealing with. That's something that I'd really try to be compassionate about. So, as a sex educator personally, in my own work, this is how I approach sex ed with adolescents. My promise to them is that I will give them all of the developmentally appropriate education that I can, and then I trust that they will make their own decisions. So I don't tell young people, don't do this, don't do that. I say, here's all the info about this, here are all the things that can happen, here are the things to know about. You make the decisions. I also hype them up to believe they can make their decisions. I love to remind young people that they're valuable, that they have agency, that they can do this, that they deserve good things to happen to them. I'm also very clear as a mandated reporter what information I can keep confidential and what information I cannot. So if I'm talking to a young person about sexuality, I will say there are things that I can keep private, but if you tell me that you have, you know, a partner that's X amount older than you, or that someone has hurt you, or you have hurt someone else, these are things that I have to share. So I'm very upfront about that. I also ground my interactions in a trauma-informed approach. And what that means in terms of sex ed is that I don't assume that the young people I'm talking to haven't experienced sexual violence. Um, I don't assume that they haven't already had some difficult things happen to them or have been shamed for sexual things or for asking sexual questions. So I keep that in mind always. And I always try as hard as I can to remain compassionate to the adolescent experience. And this is a good approach. I mean, it can be intimidating to build trust with young people, but it's really not that hard. We just have to treat them like their opinions matter, like we respect them and value what they have to say, talk to them like you know, they're grown-ups, and be compassionate and not outwardly judgmental about the things that you might hear. And like I said, you can judge and you take that stuff to your supervisor, you take that stuff to your colleagues, you take that stuff back to whoever you work with, but don't work it out with the adolescent face to face. So, personally, my hope for young people is not simply that they don't have sex. It's that if they want to have sex, they delay their sexual debut until they have as many of the following things in place as possible. And I say this to when I work with people coming out of purity culture, I often work with adults who are into their 30s or 40s or even older who have not had their sexual debut. And I tell them, before you have sex, I hope that you have the following things in place: an authentic desire to have sex, some clarity on your personal values. Like, do you think it's okay for you to have sex? A partner they feel good about. So you can define that however an individual might define it. Partner they feel good about could mean I want to be in love, or it could mean I just really want to trust this person. Um, it's important, I think, for them to have some knowledge of sex ed basics, comfort with their own body, the ability to talk to their partners and not just, be so shy and ashamed of what's going on that they're not speaking up or understanding how to give and get consent. It's also important for them to know what sexual health prevention measures they might need to use. And that depends on who they are, what bodies they have, and what kind of sex they're having. So not all young people need birth control, but those who are having the kind of sex that could result in pregnancy, I want them to know what their options are. And also, I want them to know where to go for further learning and to get sexual health care. These are some really great reputable websites for teen focused sex ed. So I can send my slides to to you all, or you can take a photo of this or screenshot it. But these are the go-to sites that I think are wonderful sex education, not just for teens and young adults, but even for grown adults. I'll leave this up for just a second. And then I also want you to know in Pennsylvania, minors can consent to their own contraceptive care and counseling. So you can go get on birth control without parental consent. You can also acquire pregnancy testing and medical treatment without parental consent. You can acquire emergency contraception and STI and HIV testing and treatment. All of this you can do without parental consent. The exception is abortion. In the state of Pennsylvania, minors do need parental permission or a judicial bypass. And that means a judge signs off and says that they can have the procedure. Those are not difficult to acquire. So some young people are on their parents' health plan and they would not seek out sexual and reproductive health care because they're afraid their parents might find out. So if you ever encounter a young person with this fear, let them know that there are clinics and places they go where they would not have to do this. And one of them includes the Children's Hospital of Philadelphia. We have a wonderful adolescent clinic. And yeah, this is my information. And somehow I did this right on time. I thought I was going to talk a little too long. So thank you very much for listening.
Thanks so much, Erica. Yeah, impressive timing. Well done. So, I think I mentioned at the beginning, but we're gonna just hang on to your questions. I know you have questions for Erica, but hang on to those. I'm gonna turn it over to Nhakia now, and then we'll have time for Q&A at the very end. Oh, Nhakia, I think you're muted still.
I am still muted.
There you go.
Good evening, everyone. Thank you, Erica. Thank you for that wonderful presentation. My name is Nhakia Outland. My pronouns are she and her. Give me 1 second while I share my slides with you. All right, can everyone see those okay? All right, awesome. So I do want to preface this before we jump right into this presentation training, is that a lot of the pictures that you will see tonight are actually pictures of my family or personal real life events that I've done with people in the community. So I'm going to jump right in. So just some community guidelines and logistics. Please respect and listen to each other. Be curious, respectful, and open. Challenge yourself and assumptions. No one knows everything, but together we know a lot. That's my biggest community guideline. I love just learning from other people and just being a continuous learner myself. I put evaluation in here because I didn't know if it was going to be an evaluation at the end. Um, and we already established at the chat box until the end. But also take care of yourself and your needs during this training. I'm going to get deeper into some of the things that Erica was talking about, but looking at it from a Black woman and girls lens. Um, so trigger content or trauma warning. This training will mention sex, sexuality, sexual violence, slavery, and enslavement, and it will center Black people, Black experiences, and Black bodies. So a little bit about me. I am a mom of three. I have two adult sons. I have one teenage daughter who you just saw on the slide. I am a macro social worker. I'm a sex educator as well as sex therapist. I'm an adjunct professor and lecturer. I'm an advocate and speaker. And aside from that, I also started a consulting business called Prevention is Key. And I am the founder of a nonprofit and I'm the executive director of that, Prevention Meets Fashion. And so, Prevention Meets Fashion is a nonprofit organization, and our mission is to increase sexual health knowledge in Black, LGBTQ, and non-binary communities through a framework that I created called FACE, which stands for Fashion Advocacy, Community, and Education. So, Prevention Meets Fashion, we use a lot of fashion-based approaches that we created to engage the community of all ages around sexual health. Prevention is key, is my consultant business that I started, and frankly is the reason why I'm like doing this training and talk and everything today. And to add what Erica was saying, I started this consultant business because people weren't talking to youth, especially Black youth, in a trauma-informed, culturally competent way. And I've worked in health centers, I've worked in all of these different centers, and I just was like, why are these Black people being, youth especially, being treated as adults instead of as adolescents, as youth, as human beings? You know, some of the things, as Erica stated in her presentation, where I was seeing youth come in and it was, why didn't you use a condom? Like, why are you back here again? Like all of these whys, and it wasn't, and their counterparts weren't being treated that way. So I started this consulting business to actually have a voice as a Black individual, to go into these organizations, go into these community centers, health centers, to say, hey, you might want to talk to people this way. You might want to take this out your paperwork, add this in your paperwork. Again, I did it from a shame free. I'm not shaming you, but this is a way that you may need to talk to folks who don't look like you. A lot of these institutions were white institutions, white ran, white led. And so a lot of them, yes, they brought in folks to, you know, do their cultural competency trainings, but actually implementing it, it wasn't happening. And so this is why I started Prevention is Key. I'm going to skip that slide because that's normally for in person. But our learning objectives for today is to understand the unique sexual health needs when working with Black girls, learning about adultification and recognize that Black girls need our protection, learn to model empathy. I'm sorry. Learn to model empathy and listening skills to build trust in relationships, create safer spaces for Black girls, be able to identify when deeper conversations are necessary. As Erica stated, sometimes when we're talking to youth, you know, we know that it's a need for deeper conversations, but we tend to just stop right there, right? And I'm especially speaking to social workers, because sometimes we get uncomfortable. Some social workers aren't dually trained like I am in sex education and social work. So some of the content that may come up when as a social worker, such as sexual assault, sexual violence, poverty issues that intersect with sex education or sexual health issues, we may stop right there and just stop at what we're comfortable at, right? And we found that with Black girls, we're missing a mark. We may need to go into deeper conversations with them, or at least refer them to folks that can have these conversations with them. Identify intersectional issues that impact Black girls, and learn to utilize new skills or approaches to working with Black girls in your organization or etc. My approach to this work is anti-oppressive, anti-racist, it's authentic. I'm always myself. I loved what Erica said, you know, I'm one way, like I'm talking to everybody. And I feel like that represents me as well. Like I'm really authentic in how I speak and how I talk. You know, I'm not a big fan of code switching. You know, years ago, you know, that was ingrained in me as a Black professional. And I sort of had to unlearn that I don't need to do that. I can show up in these spaces as my authentic self, regardless of who feelings is hurting and who don't like it. Community led, driven and focused, comprehensive and inclusive, holistic, intersectional, integrated, a womanist, and that might be a new term for some folks, so I'm going to define that, but also, and I value all identities and lived and living experiences. So what also informs my work, but also which may inform your work, is professional organizations, politics, exposure, culture, laws, morals, and values, and education. And that's why I love that I was invited to do this training, because all of us are coming in with all of these things that inform our work. And they inform our work in many different ways. They inform how we view some of the things that are said today. Many of us may act differently in all of these spaces based on where we're at, but I want y'all to take note of how you are receiving this information in these various approaches. And so before we begin, I always like to start at a base level just to define some terms. And these are not all the terms that are going to be used tonight, but just some that we should be aware of. So when I say Black girls, I'm not excluding anyone. Black girls, for purposes of this training, includes assigned female at birth, or AFAB, girls, films, and recognizes that gender is a social construct. The term Black includes a range of individuals who self-identify as Black. Again, not all Black persons identify as Black, although their skin complexion may look like mine. The term womanism or womanist was coined by Alice Walker to focus on and center the experiences of and issues of Black women. So when I say the term womanist came out of the feminist movement, but it specifically was created to center Black women, which we know wasn't being centered within the feminist movement and still is not being centered within the feminist movement. Objectification theory, or OT, girls and women are often treated and viewed as objects rather than a person. Adultification is the perception that a child is older or more mature than their age or current developmental stage. Precocious puberty, which may be a new term for some of you, is an early onset of puberty and secondary sex characteristics in children. And of course, intersectionality, which is the concept of intersectionality, describes the ways in which systems of inequality based on gender, race, sexual orientation, gender identity, disability, class, that's a mouthful, and other forms of discrimination intersect to create these unique dynamic and effects. Um, I want to show you, and it's purposeful that I put up this picture of Kimberly Crenshaw, because she coined the term intersectionality in 1989. Intersectionality is a theoretical framework for understanding how aspects of a person's social and political identities combine to create different modes of discrimination and privilege. Also, Kimberly Crenshaw is the founder and brainchild, you would say, of the Say Her Name movement and campaign, which uplifts the Black women, girls, and films lost through police violence. And I have a picture of the book right here. I actually had a class that I had read this book, just because, again, a lot of times Black girls, Black bodies are not centered. We're hearing a lot about male violence at the hands of police, but we're not hearing a lot about the women and girls who are also being unalived by police violence. So before I jump into that slide, you may be thinking, why Black girls, right? And to that I say, why not, right? Black girls are often not centered when discussing social work or sex education. Their experiences are often ignored, and when spoken about, is often spoke about in this like homogeneous way, not taking into account their intersecting identities, right? And what I want you to get from this training tonight is that although we're talking about Black girls, we're also talking about Black girls that are low income, that are poor, but also Black girls that may not be low income, may not be poor, may come from two-parent households, which again is the intersection of Black girls that we often don't talk about. When we often talk about Black women and girls, we're talking about low income, we're talking about poor, we're talking about women and girls who live in urban environments, come from single parent households, when we're missing a whole nother group of Black girls that are not coming from these situations, right? And may need the same information that we are given tonight in these trainings, right? Because at the end of the day, they're a Black person, and may not be valued as much as their counterparts. So just adding to what Erica said in there in her presentation, in Pennsylvania, the state of education is almost at failing. Pennsylvania actually gets an overall grade of a D plus for their sex education. As Erica stated, most of the schools in PA are doing abstinence education only, even when the curriculum is to do HIV education or STDs or teen pregnancy. They are not doing anything that Erica already stated in her presentation, which is healthy relationships, consent and communication, um, anatomy, um, any of these things. They're just focused on abstinence only and don't do anything, right? And so if you're not aware, in PA, we have been trying for, I sit on a coalition, we have been trying for a number of years now to actually get a sex ed bill passed, which is still being stalled. And mainly because of the political climate. They keep returning it. We don't want this language. Take this language out. We don't understand this. We don't understand that. And a lot of it is because these politicians are uninformed, and uneducated. And so hopefully we can get this corrected and actually get a comprehensive sex education bill passed in PA so that our youth are getting comprehensive sex education. So I'm not going to fully go over this slide because Erica did a really good job of going over this slide. But when we talk about youth sexual development, as Erica stated in her slides, a lot of things are happening at this middle childhood, adolescent stage, right? Puberty, their sense of identity. This is a transition phase. Um, Also, in this age range, sexual assault is at an all-time high. Actually, the median age for sexual abuse is around 8 or 9, which falls into these categories. So if we're in households or organizations where we're saying, oh, let's wait to puberty, we're already too late because a sexual assault already could occur in our young minors. Um, what I also want to say, again, about the youth sexual development is that, yes, while youth are, growing and learning their bodies, Black girls and Black boys, but I'm specifically talking about Black girls, are not afforded the normal sexual development. And a lot of times, that is because they are looked at as older and adults. And I'm going to get into that in a few minutes. So, how do we support youth sexual development? So, again, having access to comprehensive sex education, access to resources, supportive environments, harm reduction, teaching health and unhealthy relationships, role modeling, safety, acknowledging and reflecting our own feelings and bias around sex, masturbation, sexuality, and relationships, and etc. And I've have here in bold race matters because recently, especially with this political climate, people are saying, "Oh, race doesn't matter," right? But race absolutely does matter, especially in sex education. It is truly a racial justice issue. Um, and so, as I stated before, it's important that we understand the historical context, especially when we're talking about Black girls. And as I said before, Black girls are not afforded to go through puberty as their counterparts in this quote unquote normal way because they're looked at as older than what they are. They are sexualized at a very, very early age. And so when we go back to where this come from, it goes back, we have to go back to the historical context. And recently, in conversations with other professionals, including professionals that look like myself, um, it's been this debate of, can we get over this slavery or enslavement talk? Can we get over this, right? And it's like, no, we can't get over this because this is still very much ingrained in how people think, how they act, how they develop information, how they relay information. This is very much ingrained in us, right? So when we're thinking about slavery and the period of enslavement, we want to first think about ways in which colonizers came over and into Africa and first looked at our clothing and made the decision that our clothing was sexually subjective, right? We need to be covered up like white European women. Our dancing, right? Our dancing is sexually subjective. You should not be dancing like that, even though it was innate to our tribes. Um, we were looked at as property, right? We weren't even looked at as human beings. We were looked at as property versus being whole human beings. And we were looked at because of all of these things as having insatiable appetites for sex, because we dressed a certain way, because we moved a certain way, because we had more than one or two children, because they constantly saw us pregnant. It was, oh, we liked sex more, right? They weren't thinking about that our Black women and girls were being violated. They were being sexually assaulted, right? And many of these bullet points were the reasons why we were being sexually assaulted and are many of the reasons why we continue to be sexually assaulted today and not believed today, right? Think about, oh, what was she wearing, right? Your little girl shouldn't be twerking, right? Think about, even now with the political climate and treating our bodies as property, we don't have that agency. Um, and still that mindset of you want sex because you look this way, because you're shaking your body parts in videos or what have you. Also, we have to acknowledge the Black women and girl tropes, myths, and stereotypes. So, you know, being the independent woman, right? Where did this come from, right? It was because we could not depend on anyone. We had no one to go to. So this idea that we don't have anyone to go to, that we have to do it all by ourselves, that we have to be the strong Black woman, right? And you would even hear little girls saying that I have to be strong. This sexual assault happened to me, or this adult in the school system said this to me, but I have to be strong, right? I can't tell anyone that this happened to me because I probably won't be believed anyway. Also, the Mammy, Jezebel, and Sapphire tropes. And I have bullet pointed here the Jezebel because that really reigns true today, right? Again, being sexually promiscuous, calling our girls too grown or too fast, right? All of this goes back to this Jezebel image of this Black woman that's really pretty and thin and has this promiscuity about them, right? Um, and what I'm starting to do now is get away from saying sexual promiscuous, right? Especially as a social worker, I was trained in case notes to may say sexually promiscuous, right? And now I'm getting away from saying that to maybe saying having two or three partners or explicitly saying what happened to this person, right? Instead of saying that they sexually promiscuous, right? So getting away from this language that's outdated and racist. And which leads us into precocious puberty, right? So a lot of times um when we are when these ideologies are ingrained in us, we tend to not look at other ways in which uh or reasons for why young girls may uh go through puberty earlier, right? Why they might have hips and breasts and all of these things at an early age. And these are one of the reasons. This is an actual medical terminology. And as I said before, it is an early onset of puberty and secondary sexual characteristics, right? And so it's it is hard to diagnose this, but at least our Black mothers, our Black parents should be given the options to know that this is something that could happen. And so I screenshotted this newspaper article about this Black mother and Black girl who she constantly went back and forth to her doctors asking, why is my daughter developing breasts so early? Why is she developing hips so early? What is going on? And it took several doctors before a doctor actually stated that this is what her daughter was going through. So she was interviewed in this article about her experience, And other Black parents have came forward um, to talk to their providers about this. So a lot of times, because of our own biases, we are missing medical diagnosis that could be beneficial, especially for Black girls and Black bodies. And as I started talking about earlier, Black girls are often sexualized or adultified, right? Um, and, they're looked at as being hypersexual, too grown, too fast. And a lot of this is because of racial discrimination, right? Because of those historical contexts that I already talked about. Again, they may mature faster than their counterparts. So they might be looked at as um, uh, already, as I said, being grown. And it's also a form of dehumanizing Black girls and Black bodies when we're saying that they're too fast or too grown or their body is too developed. And I want to share a personal story about you with you about sexualization and adultification. Obviously, I am a Black woman now, but I was a Black girl, and I can remember early on um, being sexualized in a way that I didn't understand when I was younger. So, if you as you can see, I have full lips. And I remember at a young age being told, and excuse my language, that I have blowjob lips. I was very, very young and being told by men and boys that I have blowjob lips and oh, I must give good blowjobs because of my lips, right? And this is not in siloed. As I got older and talking to other Black women and even Black girls today, they are still being told this, right? I was also sexualized for having a thigh gap. And recently I read articles where thigh gaps are coming back now. And they're still being sexualized, right? Um, Also, even with my own daughter, I remember her in school because she liked to color her hair, a Black mom coming up to me and saying, that's a little too grown for your daughter at this age to have blue hair. Yet other counterparts don't get told that. They're like, oh, that's so pretty to have rainbow hair. That's this. But with our Black girls, when they color their hair or do anything outside of what people think is normal, they are sexualized or told that they're too grown, too fast, etc. So a Georgetown and Law Center study actually did a study and actually was one of the first of its kind that provided actual data showing how showing that adults view, excuse me, Black girls as less innocent, more adult-like than their white peers, especially in the age range of 5 to 14. Compared to white girls of the same age, the survey participants perceived that Black girls needed less nurturing. They needed less protection. They needed to be less supported, needed to be comforted less. They were more independent. Black girls know more about adult topics, and that Black girls knew more about sex. And this was an actual study that was done. And I really hope that y'all go back and read this whole study because it was really enlightening to actually have it and see it in words, how Black girls are often treated. And so some of the consequences of these for Black girls is that they are arrested, the school to prison pipeline, when they're perceived as more adult-like. Oftentimes Black girls are dress coded more, right? So they're suspended or told they have to go and change because of their outfits compared to their counterparts. In many instances, death is a consequence of being perceived as older or sexualized or dehumanized. Disruption to education, or they actually just drop out. Removal from your home, which Erica stated earlier, right? A lot of girls, the answer to them telling someone that they were sexually assaulted or that, they were neglected in their home or any of these other reasons, they are removed from their home and oftentimes put into these white institutions that don't understand. It almost feels like a punishment that I'm removed from my place of home because someone did X, Y, and Z to me, right? Suspensions, sexual violence, sexual and reproductive health concerns, substance use, and also suicide are consequences of when we dehumanize and sexualize our Black girls. This is another example of a Black girl that, frankly, I'm really upset that is not getting more attention. But Nhakia Harris disappeared in a year ago. Um, I think this month, a year ago. And her uncle, through marriage, was charged in her death. Although her body has still not been found. And this is a quote on Facebook where one man went on Facebook and said, "She got what she asked for. These kids' problem, they gonna learn. You gonna be grown, show them." So he's basically saying because this Black girl, um, I guess through what the social media was saying, was perceived as older and acting older, that she got what she was looking for by messing with her 42-year-old uncle. Not the fact that the 42-year-old uncle and it is evidence that showed that he was grooming her this whole time. Not only that, this uncle was previously arrested for having sexual encounters with two 12-year-olds prior to Nazaya's aunt marrying this uncle and bringing him into the home. It was numerous reports of relatives, of even his job, saying that they saw Nasaya come from after school and that he would take her to hotels. The system truly felt Nizaya, right? And all because they felt that she was acting too grown. And this is just one story. If you go to the Philadelphia missing um, persons report, you can see as of today how many Black missing girls there are. And I want y'all, and I caution y'all to even think about how many of those have you seen on the news lately. And so, sex ed as a social worker, right? How do we do this work? And I want to also recognize that I know again that not all social workers are dually trained like I am, right? But there are reasons why Black girls may interact with a social worker that also overlap with sex education. And this is why I truly believe that sex education should be integrated into social work programs and to our practice. So we can interact with Black girls in the mental health setting, in the behavioral health setting, in reproductive health settings, in physical health settings, in family issues when they come in, family settings, foster care and other family policing systems, legal systems. They could come in for poverty related issues. For example, food insecurity. It was just a case, I believe last year, where a girls' high student was texting back and forth and getting cash apps from a male employee at the girls' high school. And it came out that he was cash apping her money to eat with. And then eventually he started asking her to send pictures of herself. So this could have been a point where this young lady would have said, "Oh, I'm going to go see my school counselor, or I'm going to see my social worker." And they might have just overlooked, bits and pieces of these. But also, I don't want to assume that, but it also intersects with social work and sex education, right? Because this was a good opportunity to talk to this young lady about healthy and unhealthy relationships, about coercion, about sexual violence. But again, I recognize that some social workers may not be comfortable talking about that. But for the purpose of this training, I want to lay out areas that can intersect. And they also might come to us for resources and support. So they might come to us for pregnancy resources, for contraceptive resources, or other resources. And so here I try to do an overlap of where social workers and sex educators may overlap. And of course, both do advocacy. We both may work in schools or sexual health settings. We both work with families. We connect with resources. Um, However, social workers tend to, more so than sex educators, really address the trauma through counseling and other ways, right? So this is another way that having a good base of sex education can amplify our counseling, our trauma counseling. Um, Education about resources, working with marginalized populations. And as I have here, social workers may or may not be trained in sex education. I am a social worker that is trained as a sex educator and sex therapist. And also, social work in general tends to be very sex negative, tends to look at things from a deficit lens, from a risk-based lens versus sex educators. Also, the way that we have to report things, the way that we have to document things are totally different. So when I was making my transition to sex education, it was very difficult for me to take my social worker hat off. Um, because sex education, some things I'm like, oh, as a social worker, I have to report this. I have to write this way. And as a sex educator, I have more freedom to talk about pleasure, to talk about um body parts versus as a social worker. I'm constantly like, am I going to be reported because I'm talking about this? Am I going to be reported because I agree with the youth or something like that? So we have a lot of ways that um, as social workers, we can invite sex educators into our spaces, or even if it's something you're interested in, actually get trained in it. And other ways that we can see this intersection is through conversation starters, right? So whether you're a sex educator or a social worker, uh, I linked and I'm gonna give it to Allison and everyone so that y'all can look at these videos individually. But I just have some conversation starters. I know for us it's helpful to do a video and then talk to young ladies about what's going on in their world. So I'm hoping this video actually works. It's just a few minutes, but um is is talking about colorism and how colorism impacts some of the areas that I talked about, right? So you will hear from a youth that actually wanted to unalive herself because of the color of her skin, right? And this is an area that both social workers and sex educators may encounter. So I'm hoping this works. Can you
When you
hear it
think
okay?
about studies that show that women of lighter skin tones get complimented more in general in a range of things than women of or young girls of darker skin tones. So if you're talking about even just in the school setting, you have two young girls who both do a great job. They both get A's on something, let's say, and the young woman who is of a lighter skin tone gets complimented and commended more. That's where your self-esteem comes from. That's what you start to believe. And how often are you reinforcing things and that you may not even realize you're reinforcing?
I remember I would say ninth grade, I thought like, what if he just wasn't here? It'd just be easier. But like the only thing that got me through that was like my mom telling me and my friends, especially Kamaya, just like being there and someone to talk to. It just made me think like I can't leave them because it keeps me like coming to school every day and like just like the smile on my face sometimes. It's painful. It is because it shouldn't happen to anyone. We shouldn't have to hate ourselves because of the color of our skin. And the fact that I had to talk one of my best friends out of not wanting to be like that because the color of our skin, about the fact that we're just so bad. Not right. You have to love yourself and love the others around you and know that you're going to be okay. You have to stay strong. strong.
All right. So I know that video was a little emotional. I'm surprised that I didn't cry again. Like every time I watch these videos, I just um tear up because even though they were talking about colorism and unaliving themselves because of the color of their skin, oftentimes my organizations, this is why people bring us in to talk to Black girls, right? And then these conversations lead into sexual health conversations because these girls oftentimes have such low self-esteem that some young men, they pry on it, right? And so that's a end for sexual violence. That's an end for coercion. So when we think that these two worlds don't collide, they absolutely collide. So I recently started talking about colorism and sexual health, and there's also another sex educator um, um, as well, and she's a doctor. And forgive me for forgetting her name, but she also talks about texturism in sexual health, where we talk about how the texture of our hair also impacts sexual health and how many young Black girls are changing the texture of their hair just to be liked, right? And we might not think this intersects again with sexual health, but it does. Sexual health is not just about sex, it's about identity, it's about self esteem. And as you can hear from one of the young ladies that ended the conversation, was we have to be strong. This is something that I hear from Black girls all the time. They're not afforded the safety and spaces to just be in their feelings. It's always we have to be strong, right? And I'm sorry if I get emotional, but having a Black daughter myself and being a Black person, this really impacts me because why do we always have to be strong? Even as a social worker and sex educator myself, sometimes I just don't want to be fucking strong. I want to be like, why do I constantly have to fight, right? Fight for my profession, fight for my career. Even as a Black sex educator, I'm not believed as much as, let's say, if I was in a room with a white sex educator, right? I might not get hired to talk to Black girls because I am a Black educator, right? Sometimes people believe white educators more than they believe a Black educator with the same credentials. And I'm getting emotional because I just did an event on Sunday where I talked to young Black girls and their mothers about the rates of HIV right now. 50% of Black women are new diagnosis of HIV. So when we say race doesn't matter, when we say, or just in our social work classes, when we just talk or make blanket statements about human development and development, it really sets a fire underneath me because Black girls are not afforded the same rate and normacy to develop into adolescence, to develop into adults as their counterparts, whether it be another youth of color or a white youth. They are not afforded that. They are always looked at as being older, as being adults, as being the problem. You got sexually assaulted because you did something, right? And I know many of us that may look like me on this call have been told once in their life, don't wear that because Uncle such and such is downstairs, right? Instead of, why did you even allow Uncle such and such to come into this house, come into my space, when you know that there might be something going on? We need to have more conversations, especially with Black girls. So going back to what I said in the beginning, why Black girls? Why not? We have to learn to tailor our information and to tailor our education to be able to talk to Black women and girls in a way that affects them and impacts them. And you do not have to be a Black social worker or Black sex educator to do this. Does it help? Yes. And so going into community education as another strategy, this is one of my strategies. I am a community social worker, and I just got to the point where I could say that I'm a damn good community social worker. Like, I am known in Philadelphia for going into communities and making these wonderful relationships and long-standing relationships. In this photo is another social worker, but also a social work student, as well as two girls that was in this program that I went out to talk to about issues such as this. And so, um, you know, it was really important, and I want to give you this story. It was really important for me to go out, but what was so profound about this event was that I came in and I introduced myself and gave my pronouns. But beforehand, I asked did any of the girls identify within the queer community, and I was told by the organization no. But I went in being authentic, said my name, said my pronouns, invited them to say their name and pronouns, and several of the girls actually said that they use she and they, but they had never been invited in that space to actually say that they use she and they pronouns, not she and her pronouns. So they sat in this space being mispronounced week after week because they didn't feel safe enough to say that I also use they pronouns. And so we need visibility. We need to create safe space for Black girls to be able to express themselves. And we need to be authentic and build authentic relationships. It's time to stop with this performative stuff. And this is the reason why a lot of these DEI rollbacks have been so easy for some organizations, because it was performative. It wasn't built into the fiber of their organizations in the beginning. And so, what does integrated care look like? So essentially, what I've been talking about, this past few minutes, because I talk pretty fast. um, this is what integration looks like, right? As you can see, not one of these pictures, I'm in an office environment. I am in the community. And out of all of these pictures, one of these pictures is actually me at Pride with two of my interns who are actually sex workers, right? And we're doing the work. We're talking to other young ladies who may be in sex work, right? One of these pictures, I am at the Philadelphia Sexual Assault Resource Center here in Philadelphia, figuring out a way how can we uh, integrate ourselves and work together to be able to have an impact on young ladies that's coming in from being sexually assaulted, right? And one of those ways that they identified is that a lot of the young women and girls coming in were sexually assaulted. And when they were sexually assaulted and had to give their clothes for to the police, they oftentimes were given just a robe to leave out with. And so one of the ways that Prevention Meets Fashion partnered with them was now we have a pop-up closet at PSARC now where people can have dignity. They can get clothing that fits them to be able to leave, because a piece of their dignity has been taken from them. And I know that is just a small piece of their healing, but just to see the smile on someone's face, to be able to get a new pair of underwear, a new pair of pants, or something after being sexually assaulted. At the top photo, that's me and my bestie, and Christine Brunson, who also is a social worker, a licensed social worker, who also started an organization because of the same reasons. She was seeing that Black women and girls in intimate partner uh, situations weren't being talked to in a way that needed to be talked about. And so this is us in the middle of City Hall, and some politicians came down and they asked us about our organizations and the ways that we work, and why we weren't getting funding, right? And that's the biggest question, why we're not getting funding. And I'm really blunt, and Christine will tell you I'm really blunt. And I said it's because we're Black, we're Black led, that we're not getting funding, right? Um and the same issues that I talked about of why Black women and girls don't get believed all the time is some of the reasons also why we don't get funding as well. Um, can everyone still hear me okay?
Yeah, I noticed you look a little frozen, Nhakia, but we can hear you okay still. And also
Okay,
just do a little time check. I think we're right. We're getting right to
okay,
the end here.
perfect, because I thought I had froze. Um, and then this is a
Oh no, I think the freeze caught up to her. Hopefully Nhakia will be able to sign right back on. I think we lost her though. Thankfully not right. Oh, you're there. I see you. Hi.
Okay, it wasn't allowing me to unmute. Um, so let me see if I can share real quick just to finish up the last slide. Okay. And so, just to finish up, this is just a call to action in organizations that are doing the work. So obviously my organization, Prevention Meets Fashion, but also YAP, which is a young artist program, which was started by youth. We Reign, which works with Black girls, and of course, Purple House Project, which I stated already. And so we want to speak up, call it out, demand justice, and protect all Black girls. And as I said before, support the smaller organizations and programs that are doing this work, because many of us are not getting the funding that we need to continue to do this work. And I think, sorry for going a little bit over, but we're right at time.
Yeah, no, you did great. Both of you are amazing with time. Thank you so much, Nhakia. That was powerful, and thank you. Both of these presentations were so informative, and I know there's going to be lots of questions. Let me enable the chat. Please feel free. I'm going to ask just to hold off until the end with like, I know all of you probably have lots of just like gratitude and thanks for our presenters. I'll just ask you to hold off until the very end to make sure that we don't lose the questions. But so for now, if you could just enter any questions that y'all have into the chat. We have about 15 minutes left of the training. And I see a question here from a familiar name. So amazing presentations, both of you. Could you speak on offering sexual health education in settings where you have to be careful about politics or stakeholders? I work as a social worker in a K-8 Catholic school, and I feel it would be so impactful to offer sex ed classes, especially about puberty for younger kids. I'm going to talk to my principal about this, but I'm worried about the parents, especially those that are religious, and especially in this climate. That's real. I think I'll just open up, Nhakia or Erica, if either of you wants to like kind of jump in. I know, Erica, you've got some in-school experience and might be able to speak to that. Oh, are you also unable to mute? There you go.
Okay. Yeah. Also, Nhakia, that was so amazing. Your presentation was so good, and I'm so glad that I got to share the time with you today. I would say this is such a difficult thing to be dealing with right now. And there is no easy answer to this. It is very true that whether or not a school will allow any kind of sex ed program is dependent on the school board, the administration, and the parents who get involved. I speak from experience. I had uh, a very wealthy private school in the suburbs contact me about doing a sex ed unit for their middle schoolers a couple years ago. And we're talking like it costs like 30 grand to go to first grade at this school. Like wild. Not what I'm used to, not what my experience is. But when I gave my curriculum over, they said it was wonderful. And then they informed the parents, this woman's coming to do this sex education. And it was over. It was over before it started. They contacted me the night before and were like, you can't come and do this. And that was a couple years ago. So it is tough. I'd say it's definitely worth talking to the administration and presenting your ideas, presenting what type of materials you would use, and you would probably have to adjust them according to the community's standards. But it's just a really, this is a really, really, really difficult time politically for this.
Thank you, Erica. Yeah, it's really scary to think about that in terms of just the very real consequences for young people yeah. Oh, Nhakia, I'm so sorry. Let me unmute you. I don't know why it's doing that. I apologize.
That's okay. I just wanted to second what Erica says. I actually, because of this issue, do eighth grade up now, because of such difficulty, doing the younger grades. And so, what I was second what Erica said is, you don't have to be a parent to go to school board meetings. So if this is something that you really want, you could go to a school board meeting and present it, just to put it out there. Also, because we talk about sex education, from a fashion point and often use fashion, a lot more schools are okay with us coming in because it's a way to get around the parent stuff because we're coming in and talking about like sexual violence based off of what you was wearing, right? So consent, like you shouldn't be touching someone's shorts, right? Or something like that. So using a lot of creative therapies or creative modalities is a good way to get around this. I actually will actually decline schools that won't allow me to bring in anatomically correct objects because I believe that, well, we know that it's research that shows that when kids know their correct body parts, their names and everything, it shields them from sexual violence.
Thanks, Nhakia. I'm just also trying to make you there we go, a co-host. So hopefully you'll be able to unmute yourself. Um, Melissa, I think this is more just a comment, but in the chat, commented, I really appreciate the knowledge and expertise that both presenters brought to the training tonight. I'm an LCSW working in higher ed. I come across many students who transition from high school to college and feel that such education is necessary and not talked about enough, especially as IPV and sexual violence is prevalent on campus. So yeah, just kind of underscoring the importance of this. Julie was asking if y'all ever do trainings or pop-ups in the mental health setting. Um,
Yes, we do. That we do a lot of actual pop-ups and whether it be for staff or just with the clients. Actually, we are, I know this is not youth but it's with adults, but we actually, I will be popping into Action Wellness, which is a HIV organization here in Philadelphia, to actually talk to their women who are living with HIV and are pregnant. And what they've been noticing is a lot of the women are coming in with STI still. And so, yes, we actually do those things. I know that's not a mental health setting, but some of these women have intersections of that. But yes, we actually do. We've popped into disability organizations to talk about disability and sex. Again, disability and fashion and how it intersects with sex. So yes.
Melissa asked any tips or suggestions of how to talk about sex ed in the context of relationships and use of dating apps. For example, polyamorous, casual dating, and I think probably a common feeling of just wishing they were more versed in this. Any thoughts?
I'll just start by saying this is one of the areas in which the times have changed so much because, yeah, dating apps didn't exist when most of us were teenagers, and now young people are using them, high school and college even. And so I I mean, it's something that I find challenging as an educator when that comes up for me because I'm not that well versed in it myself. So I think that some of the websites that I recommended do have really great comprehensive sex ed, and there's also like really great sex education creators online. And there are some Instagram accounts that are very specifically about dating and being on dating apps. And if I can remember them off the top of my head, I will share them with you. But it is a challenging topic. I would love, I'm curious about what you think about that too, Nhakia.
I second that. It's dating apps are very challenging topic for me and people at my organization. Especially I know for me because I'm not on any of the dating apps, so navigating it is kind of hard. But we tend to uh get folks primarily that are not cisgender, so the LGBTQ community, and the youth that frequent the dating apps and how they navigate that, which we have to watch out a lot for, which Erica talked about, which is the age of consent a lot on those apps. As far as polyamorous relationships, we talk a lot about that in both of my organizations through um, healthy and unhealthy relationships. And believe it or not, a lot of youth are interested in polyamorous relationships, where years ago, where I would intersect and say, excuse me, um let's name the types of relationships. Years ago, no youth would ever say polyamorous. Now that's the first thing that youth say is polyamorous relationships, and like want to talk about it so much. So a lot of youth are into polyamorous relationships or know someone that's in a polyamorous relationship. Their parents might even be in polyamorous relationships. So that is something that we definitely need to talk about. I saw Erica put sex positive families in there. Yes. Also Amaze does cartoon type things on dating apps and just like internet stuff. Amaze .org does a lot on that as well.
Thank you both. And I think we're coming close on time, but I think we can definitely squeeze in one more question. Desiree asked, do either of you, I think this is actually what, Erica, you were kind of responding in the chat to this, but just in case there's anything else that folks want to add, resources directed specifically towards foster kids and how to best help them with sex education, just any other advice for working with youth as like an independent living social worker.
I have a resource that I'm actually going to put in the chat for you. It is a developmentally appropriate approaches to discussing sexual and reproductive health with foster care youth. And it really covers a lot of the talking points that both of us shared today, like what kind of information should be talked about, what's age appropriate. So I think this would be a good place to start. Yeah, thank you.
Yeah, and I also would say check with the agency as well in your guidelines. As someone who worked in those spaces, it's often hard to, even when you know you want to talk about it. Like I worked in a lot of group homes, especially religious group homes, and a lot of stuff we couldn't talk about, even though we were trying to talk about it in the least possible direct way. We still couldn't talk about it. So I think that would be my advice, to just make sure that you can give this resource and talk about it within those spaces, even in independent living spaces, because especially with the political climate, they might be getting funding. You might not be able to say certain things, and it might put this person in the client in jeopardy and yourself in jeopardy. So just be careful about that.
Yeah, this is a very, very difficult time to be in the sex education field or the sexuality research field. It is really difficult to approach this work while also censoring ourselves, because we're out here trying to break the stigma and shame about sexuality. But when we have, like, I'm sure you do this too, Nhakia, where you like post about it on Instagram or something and you have to like censor the word sex and spell it some funny way or like use euphemisms, and that feels very silly and it feels very stigmatizing and it feels the opposite of the message we're trying to put out there. But right now we really don't have a choice but to continue to do this work. And I always feel like I'm dancing on a tightrope. Like, what can I say? What can I not say? What can I do until I get told not to do it? And I think if any of you are thinking about, providing this kind of education or conversation to young people that you work with, that's probably something you'll have to be thinking about as well.
Uh,
And
oh,
And
go
if
ahead.
I can have one final thought, because I know we're like
Yes.
1 minute past. I would be remiss if we didn't get off this call and say it, but we're in the final stages of Ramadan. And I know that we get a lot of queer sex ed questions, and there are some amazing Muslim women that are sex educators and social workers who's also doing this space. I don't have their Instagrams right on hand, but I'll try to get them, and let Allison know, because, you know, again, we talked a lot about youth and the intersections, and that's one intersection of youth that we may be missing with a lot of sex education and a lot of different and how to navigate that within our religion as well. I was less conservative growing up in my household, but I do respect conservative Muslim households that is very hard to navigate menstruation, navigate sex ed conversations, marriage early, all of these things.
Thank you so much, Nhakia, for bringing that into the space. And I think I see Erica identified one of the Instagram accounts. Also, we have two amazing sex educators obviously here with us tonight. If you're interested in finding them on social media, just as another kind of ongoing resource and a way to continue to keep up with the incredible work that they're doing, please feel free to do that. And Erica and Nhakia, if you want to put any of that stuff in the chat so folks can connect, please feel free to. And we will provide the resources. So we recorded this presentation tonight. This will be available on the YouTube page, and we will also connect lots of these resources that they provided there as well. So just thank you both again so much. This was so powerful and informative, and we're just really grateful that you were here tonight. Appreciate the bravery and just, yeah, critically important work. Thank you so much.